The new COVID-19 variant known as Eris is now the dominant strain in the U.S., but an even newer variant is now raising concerns. Medical reporter Liz Bonus explains why.
Hey there, hello to you. What those tracking this newer variant are concerned about is what's called this highly mutated strain. Its nickname is Parola, which by definition is a plant that lacks a permanent woody stem. Here's what we know about it, and here's what we don't.
We don't know how many of those who are hospitalized now are infected with this new Parola strain. We do know, however, that hospitalizations are climbing, according to the CDC COVID data tracker. Infectious disease specialist Dr. Stephen Blatt, who tracks the COVID-19 numbers for one of Ohio's largest hospital systems, TriHealth, says we also do know, for the first time in a long time, his team is seeing
couple people in the ICU, which is really unusual. We haven't seen ICU patients in probably a couple of months.
We also do know that Parola, or BA2.86, is different than previous COVID-19 variants. The CDC describes it as a new lineage.
BA2.86 is the one that's just been identified. Only one case of it here in the United States so far, but it has a lot of variation in its mutations, like 36 different mutations, which is dramatically different from the Omicron variants we've seen, which are maybe one or two mutations different from the previous variants.
So that means we also don't know if the new vaccine this fall will provide protection against severe illness from it, or whether your previous immunity from infection will keep you from getting very sick and ending up in the hospital if you do get it.
Now, some hospitals are starting to bring back mask mandates in anticipation of the spread of this newer variant. I'm medical reporter Liz Bonus. Back to you.
You can always find our local 12 stories right here on YouTube. Don't forget to tap subscribe, and then you can get all the notifications.